Hello everybody. This is a case of traumatic cataract, and you can see it is a hypermature cataract with flocculence-less materials in the anterior chamber. Probably it is in the posterior chamber too. In the one side, there is vitro uveal prolapse and also vitro uveal traction and also dialysis. So I am trying to start this surgery. First, a small incision. I just make it clear with the vision blue to make a good capsulorhexis. With the visco feeling, the things are clear. Now I'm cutting the vitro-uveal traction band. It's very tough to do the capsulorhexis in this situation because the capsule is very much thick and also it is torn out. So I'm trying to cut it with the vertical scissor, micro scissor, but it is too tough to cut. Now I'm trying to cut it with the curved venous, and it is possible. I'm removing the capsule which is almost pigmented. I'm trying to remove the cortical matters from the anterior chamber, as some cortical matters in the posterior chamber under the capsule too, but luckily it comes out. But you can see in the wound there is a vitreous. I'm doing the vitrectomy, adequate vitrectomy. Now again I am doing the vitrectomy to clear out the wound and the margin of the pupil. The most important thing, the challenge is to put the intraocular lens, because the intraocular lens can be go out through the vented capsule into the posterior chamber or in the vitreous. It's really tough, so I first put it in the anterior chamber and then I just make it a position over the posterior capsule, half supported posterior capsule. I am making a suture to make it stable. It is very much important to undermine the suture, trying to hydrate the wound. And you can see there is a traumatic rent and dialysis. And I think it is done perfectly. Thank you so much. Pray for the patient.